We all know that feeling, right? Wanting to grasp something complex quickly and just get straight to the point without getting lost in the weeds.
Yeah, exactly.
Well, that's our plan today. We're doing a deep dive into a pretty specific health issue affecting Chinese Shar-Pei dogs, Familial Shar-Pei Fever, or FSF.
And we've got some really detailed info here, stuff that breaks down the condition, where it comes from, how vets manage it.
Right. So our mission really is to pull out those critical pieces of information for you. We want you to walk away with a clear understanding of FSF, but without feeling totally bogged down by technical stuff.
Let's get into it then. FSF.
Okay. Familial Shar-Pei Fever. The name itself tells you a bit, doesn't it? Familial runs in families. Shar-Pei the breed. Fever.
But it's more complex than just, a dog getting a temperature. The sources call it a familial autoinflammatory disorder.
Autoinflammatory. So the dog's own immune system is going haywire, essentially.
Exactly. It overreacts, leading to these repeat episodes of fever and a very typical sign, swollen hocks. Their ankles.
Swollen hocks, right. I remember reading that.
But, while those signs are noticeable, the bigger worry, the long-term thing, is the link to progressive systemic amyloidosis.
Amyloidosis. Okay, that sounds serious. Let's circle back to that. But first, the why. What's actually happening pathologically?
Yeah, the why. It boils down to a genetic defect. Something's up with their innate immune system, the body's initial defense squad, if you like.
And here's something I found really fascinating. The sources mention that the Shar-Peis with the really heavy wrinkles, the meat mouth types, they seem to be at higher risk.
That's right. It seems they have a greater number of the mutations involved. It's an interesting link, isn't it, between that distinctive physical trait and this health problem.
Definitely makes you think. So these genetic changes, what do they do?
Okay, so they lead to an increase in something called low molecular weight, hyaluronan, LMW-DHA for short.
Hyaluronan, like hyaluronic acid, stuff in skin and joints.
Sort of, yes. But this is a smaller fragment, LMWHA. And in these dogs, there's too much of this smaller piece floating around. And that excess LMWHA acts like a danger signal.
A trigger.
A trigger, exactly. It sets off this whole inflammatory cascade. The body starts pumping out pro-inflammatory cytokines, these signaling molecules. The sources specifically flag interleukin-1 as like a really key first responder here.
And I bet it doesn't start with just one cytokine.
No, you got it. That initial release triggers others like TNF-alpha and IL-6, and all that activity ramps up the production of something called serum amyloid A.
Serum amyloid A, okay, and that's where the amyloidosis comes in.
Precisely. Too much serum amyloid A leads to it depositing as, amyloid protein in different tissues all over the body. It's an abnormal protein buildup.
Where does it typically build up?
It can be widespread, but clinically the most critical spots are the kidneys and the liver.
Okay, so what happens when amyloid clogs up the kidneys and liver? What are the consequences?
Well, in the liver, the amyloid makes the tissue really fragile, so fragile it can actually rupture, which causes internal bleeding that's hemoabdomen. Very serious.
Wow. And the kidneys.
In the kidneys, it's called renal amyloidosis. It damages the filtering units, leading to something called nephrotic syndrome, basically. The kidneys leak protein and don't filter waste properly. And it also makes the dog more prone to blood clots, a state we call hypercoagulability.
This sounds awful. The sources compared it to familial Mediterranean fever in people. Does that help explain it?
Yeah, it's a decent parallel. Both involve these recurring bouts of fever and inflammation of serous membranes.
Serous membranes, like linings.
Exactly. Linings like the pleura around the lungs, the peritoneum in the abdomen, and the synovial membranes in the joints. So it's this widespread episodic inflammation.
Got it. So it's definitely not just fever and swollen ankles. This thing hits multiple body systems.
Oh, absolutely.
Yeah.
The impact is systemic, and the signs really depend on where that amyloid is causing the most trouble. The info we have lists quite a few affected areas.
Okay, let's run through those. Maybe start with the heart and blood vessels, cardiovascular.
Sure. So cardiovascularly, there's that risk of blood clots. We mentioned venous thrombosis, things like pulmonary thromboembolism, or PTE, a clot in the lungs, and also systemic hypertension, high blood pressure.
Okay. And the digestive system, gastrointestinal.
Yeah, GI signs are common, things like abdominal pain, vomiting, diarrhea. And then the more severe stuff, like hemoabdomen from a liver rupture, or ascites, which is fluid buildup in the abdomen.
What about blood itself and the immune system?
Good point. You can see anemia, often non-regenerative, meaning the body isn't making enough red cells, high white blood cell counts, sometimes with what's called a left shift, lots of young white cells fighting inflammation,
Hmm.
clotting problems, including that hypercoagulability, and sometimes even low levels of immunoglobulins, the antibodies.
And the liver, we mentioned rupture, but other signs?
Right. Hepatomegaly and enlarged liver, elevated liver enzymes on blood tests indicating damage, and just generally impaired liver function.
Mhm. And the joints and muscles musculoskeletal, that seems pretty key given the swollen hocks.
Absolutely. Joint effusion fluid buildup, especially in the hocks, that causes lameness, stiffness. Sometimes owners describe it as walking on eggshells.
Yeah.
You might see a hunched or roached back posture and just a general unwillingness to move.
Even the nervous system?
Yeah, potentially. Vascular accidents like strokes are possible, or sudden neurological signs like a head tilt, balance issues, vestibular ataxia, maybe even seizures.
Man, this is far-reaching. Eyes, kidneys.
Eyes, yes, risk of retinal detachment, and kidney's urinary system.
Hmm.
You'll often see protein in the urine, proteinuria, dilute urine, low specific gravity, and the dog drinking and peeing a lot. Polyuria and polydipsia, or PUPD,
Breathing problems too.
can happen. Rapid breathing, tachypnea, or difficulty breathing, dyspnea.
And the skin, besides the swollen muzzle.
Besides the swollen muzzle and the swelling around the joints, you might see jaundice, that yellow tinge due to liver issues, or even skin sloughing in really severe cases.
Wow, that's a lot of potential problems stemming from one underlying condition. So we know it's Shar-Peis. How is it passed on? Genetics.
Yes, it's confirmed as an autosomal recessive inherited disorder,
Meaning?
meaning a pup needs to inherit the faulty gene from both parents to actually get FSF. If they only get one copy, they're a carrier, but usually won't show signs.
How common is it? Do we have numbers?
The estimates are pretty significant. Somewhere around 23 to 28% of all Shar-Peis are thought to be affected. And if a Shar-Pei does have a fever, there's like a 53% chance it's FSF. So over half.
That's high. When does it usually show up, age-wise?
The average age of onset is around 4 years old. But the range is really wide, anything from 19 weeks, so quite young, up to 9 years old. And there seems to be a slight tendency for females to be affected more often than males.
Okay. So if you have a Shar-Pei, what specific things might you notice at home that should ring alarm bells?
Well, the signs can vary a lot, like we said, depending on which organs are hit hardest and how bad the amyloidosis is.
Mm-hmm.
But we can kind of group them into history, what you observe over time, and physical exam findings, what a vet sees.
Let's start with history. What might an owner report?
Recurring episodes are key. Episodes of the dog just being off its food, really lethargic, seeming stiff, and then that classic swelling of the hocks or the muzzle, which might just come and go on its own, or maybe seems better after an NSAID pain reliever.
Okay.
Also, watch for intermittent tummy troubles, pain, vomiting, diarrhea, and definitely the increased drinking and peeing or unexplained weight loss. Those are big clues.
And what would a vet look for during an exam?
A really high fever is classic, like 103 to 107 Fahrenheit, or 39.4 to 41.7 Celsius, and it typically lasts about 24 to 36 hours.
Right, that specific duration.
Exactly. Plus, the dog is usually lethargic, maybe dehydrated. Those puffy, swollen tissues around the joints, especially the hocks, are very characteristic. Sometimes you can feel fluid in the joint itself. Swollen muzzle is common, too.
Yeah.
The vet might also find abdominal pain when they feel the belly. The dog might be reluctant to move, have that hunched posture, rapid breathing, maybe an enlarged liver or fluid in the abdomen as cites possibly jaundice. Pale gums could point to anemia from kidney failure, or rarely, that internal bleeding.
So it's really putting together the owner's story and the vet's exam findings. Now, besides the genetics, are there other triggers, things that can set off an episode or contribute?
Yeah, the sources mention that the fundamental issue is this dysregulation of inflammation, which makes them prone to reactive amyloidosis. But it's important to know that any chronic infection, ongoing inflammation, immune disease, or even cancer could potentially trigger amyloid buildup in these predisposed dogs.
So other underlying issues could be involved.
Could be. And stress is also mentioned as a possible trigger, just for the fever episodes themselves.
Makes sense. Diagnosing this sounds like it could be a puzzle then. Lots of signs overlap with other conditions.
Absolutely. Differential diagnosis is crucial, ruling out other stuff.
Like what?
Things like tick-borne diseases affecting joints, Lyme, Ehrlichia, immune joint diseases, lupus, idiopathic polyarthritis, other causes of jaundice, chronic kidney failure for other reasons, causes of PBUD like diabetes, and just general fever of unknown origin. You have to consider all those.
So what tests help narrow it down? What do vets typically run?
Basic blood work and urine tests are usually the starting point. A CBC, chemistry panel, urinalysis.
And what might those show?
You might see that non-regenerative anemia, high white cells, signs of kidney trouble like high BUN, creatinine, phosphorus, maybe acidosis, low blood protein, specifically albumin, high cholesterol, elevated liver enzymes, or bilirubin. Protein in the urine is a big flag, though not always there, and the urine might be very dilute, low specific gravity.
Are there more specific tests?
Yes. Depending on the signs, you might do tests for tick diseases, heartworm, immune tests like Coombs, ANA, rheumatoid factor, coagulation tests, PT, PTT, D-dimers, antithrombin of the third, are important if you suspect clotting issues or before a biopsy. Immunoglobulin levels can be checked. And the urine protein-creatinine ratio, the UPC, is really key for kidney involvement. A UPC over 13 is highly suggestive of amyloidosis.
What about looking inside? Imaging, X-rays, ultrasound.
Imaging definitely helps. Abdominal X-rays might show an enlarged liver or fuzzy detail if there's fluid. Chest X-rays could show fluid around the lungs. Joint X-rays usually just show soft tissue swelling, not bone damage.
And ultrasound?
Ultrasound can be very useful. It might show changes in the liver. Maybe it looks darker with rounded edges. And the kidneys might look brighter than normal, with less clear distinction between the outer and inner parts.
But the gold standard, the definitive diagnosis, involves actually seeing the amyloid, right? Like a biopsy.
That's correct. You can analyze joint fluid, but it might not show much. The best way is a biopsy, usually of the kidney cortex or the liver. Fine needle aspirates might give clues, but a tissue biopsy is better.
How do they confirm it's amyloid?
They use a special stain called Congo red. When you look at the stained tissue under polarized light, the amyloid lights up in a specific way. Apple green birefringence, they call it. But crucially, you need to check clotting times before doing a biopsy because of the bleeding risk, especially with the liver.
Okay, so you've got the diagnosis. What then? How is FSF managed? Is there a cure?
Unfortunately, no cure. The sources are clear on that. Treatment is all about palliation, managing symptoms, trying to slow down the amyloid deposition, and maintaining quality of life.
How intensive is the treatment?
It really varies. Mild fever episodes might just need supportive care at home. But if the dog's not eating, severely lame, jaundiced, vomiting, has bad diarrhea, or seems really dehydrated, they'll likely need hospitalization.
And for really severe cases?
Yeah, if there's organ failure or a suspected blood clot, that requires intensive care. And emergencies like a liver rupture or a major clot need immediate stabilization, of course.
What does that supportive care typically involve in the hospital?
It's the fundamentals, really. A FAV, fluids for hydration, oxygen if lung clot is suspected, maybe draining abdominal fluid if it's making breathing hard, blood transfusions for severe anemia, fresh frozen plasma if there are clotting issues like DIC, antibiotics if infection is suspected. Pain relief is important, but again, avoiding NSAIDs if there are kidney or GI problems.
Okay.
Gastroprotectants might be used if stomach ulcers are a worry, and limiting activity during those fever spikes is usually recommended.
Any specific diet recommendations?
Yes, diet's important, especially with kidney involvement. Protein and phosphorus restriction is often needed based on the stage of kidney disease. Vets use the IRIS staging system for that.
What about liver issues?
If there are signs of hepatic encephalopathy liver problems affecting the brain, then protein restriction might be needed once the dog is stable. And there's some suggestion that omega-3 fatty acids could be helpful for the kidney aspect, the glomerular disease.
Now, what about specific drugs for FSF? Anything that targets the disease process itself?
Well, the main one mentioned is colchicine. It's often started early in the disease. The thinking is it might help slow down amyloid deposition. Its effectiveness, once significant amyloid is already there, is less clear, but it's commonly used.
Any others?
DMSO has been used historically, but the sources suggest its benefit is questionable now. Steroids are generally avoided unless there's specific other immune disease happening at the same time.
Why avoid steroids?
There's a concern they might actually worsen amyloid deposition, so generally not used for FSF itself.
Okay, what else? Aspirin?
Low-dose aspirin might be considered if hypercoagulability is a major concern, to reduce clot risk. For dogs losing a lot of protein in their urine, ACE inhibitors like enalapril or benazepril or ARBs might be prescribed to help manage that. And of course, medications if high blood pressure is present.
Are there pitfalls with these meds? Contraindications? Side effects?
Definitely things to watch out for. We mentioned avoiding NSAIDs with kidney GI issues. Don't give aspirin with NSAIDs.
Okay.
Colchicine shouldn't be used with cyclosporine. ACE inhibitors need caution if the dog is dehydrated.
And side effects.
Yeah, colchicine and DMSO can both cause stomach upset, vomiting, diarrhea. Long-term colchicine has a potential risk of bone marrow suppression, though it seems uncommon at standard doses. And DMSO, well, it has a very distinctive, strong garlic-like odor that gets everywhere.
Good to know. Since this is a chronic, progressive thing, what kind of follow-up is needed? How do you monitor these dogs?
Regular checkups are key. Monitoring urine-specific gravity, the urine protein-creatinine ratio, is really important to track kidney protein loss. Regular blood work chemistry panels to check kidney and liver values, albumin levels, CBCs to watch for anemia or inflammation signs. And for dogs on blood pressure meds or with hypertension, regular blood pressure checks and eye exams are needed.
Okay, last couple of points. Prevention and the overall outlook.
Prevention really comes down to responsible breeding. Avoiding breeding dogs from lines known to have Shar-Pei fever is the main advice.
And the prognosis. What's the expected course?
It's typically a waxing and waning disease, but overall progressive. The prognosis is generally guarded fair to poor. It really depends on how early it's caught and how severe the organ damage is. Sadly, it is ultimately fatal, usually due to kidney or liver failure.
How long might a dog live with it?
That's highly variable. Some dogs decline very quickly within weeks or months. Others, especially if diagnosed early and managed carefully, might live for several years, sometimes even over 10 years, though that's less common. Complications like liver rupture or a major PTE can obviously cause sudden death. And there's a rare, severe inflammatory syndrome called neutrophilic vasculitis, or STSS, that can occur.
This has been incredibly thorough. It really paints a picture of FSF as much more than just, random fevers.
Absolutely. What really stands out, I think, is that connection between the breed's famous wrinkles, that excess hyaluronan production, and their predisposition to this serious inflammatory disease. It shows how traits we select for can sometimes have unintended health consequences.
That's a powerful point. And just the sheer number of body systems that can be damaged by the amyloid. It really drives home how systemic and complex this is.
It underscores the need for awareness, early diagnosis, and proactive management to give these dogs the best possible quality of life for as long as possible.
Definitely. And it leaves you, the listener, with something perhaps deeper to think about. The story of FSF and Shar-Peis really highlights the broader ethical considerations and challenges involved in managing genetic diseases within specific breeds. It's certainly food for thought,